Okay, we got everybody here? Okay. Good morning. I'm Rich Guidice, Executive Director of the Chicago Office of Emergency Management and Communications. As Chicagoans get ready to ring in the new year, we want to remind everyone to do so safely. Public safety is our number one priority, and the city remains ready to respond to all safety hazards with city measures to ensure a safe New Year's Eve celebration. The 1.5-mile-long display is set to begin at midnight and will be launched from 5 bridges and 2 river launch points along the main branch of the Chicago River. The display can be viewed along the Chicago River from Wolf Point near the Franklin and Orleans Street Bridge to Columbus Drive and east to Navy Pier. Fireworks will also be broadcast live on WGN TV. For safety precautions, viewing will not be allowed from the Chicago Riverwalk. OEMC is urging pedestrians, motorists, spectators, and residents to be aware of closures in the Central Business District during this event. At 4 p.m., the Chicago Riverwalk will close east of State Street to all pedestrian traffic. The remainder of the Riverwalk west of State Street will be closed based on public safety and operational needs. Beginning at 11 p.m., complete closures to all vehicular and pedestrian traffic will go into effect for the following bridges: Franklin and Orleans, LaSalle Street, Clark Street, Dearborn Street, and State Street. Also at 11 p.m., eastbound Upper, Middle, and Lower Wacker Drive will be closed to vehicular traffic from Lake Street to Stetson Avenue. We anticipate all streets and bridges to reopen to vehicular traffic approximately 10 minutes after the firework display or when deemed safe to do so around 12:30 a.m. on Saturday, January 1st. Safety measures will also be in place on the river. Boats will not be allowed to transit within the U.S. Coast Guard safety zone, which includes the area west of the Franklin Street Bridge and continuing east of the Columbus Drive Bridge. Traffic control aids will be on hand. As always, public transportation is strongly encouraged. For official information and impacts on CTA service and routes in the area, visit CTA website at transit-chicago.com. CTA will once again provide free bus and rail rides beginning at 10 p.m. on Friday, December 31st until 4 a.m. and Saturday, January 1st. OEMC will continue to monitor all citywide events, activities, traffic, and weather conditions from the Operations Center, our 911 floor, and coordinate public safety resources as needed with the Chicago Police Department, Chicago Fire Department, and infrastructure departments. While we make every effort on behalf of the city to keep residents and visitors safe, we want everyone to know that they have a role to play as well. The public is encouraged to be aware of their surroundings and report suspicious activity posing an immediate threat by calling 911. If you see something, say something by notifying on-site security or call 911. Stay informed of emergencies. OEMC issues several alert notifications. To receive Notify Chicago text and email alerts, residents can subscribe at notifychicago.org or visit chicago.gov/OEMC. I want to wish everyone a safe, healthy, and happy New Year. Now please welcome Mayor Lori Lightfoot. Mayor.
Good morning, everyone, and thank you, Rich, for setting the table for this important discussion around plans for the end of the year, both from a public safety but also from a public health perspective. As New Year's Eve rapidly approaches, I know that safety and health are top of mind for all of our residents. That's why we've gathered here today to not only share our comprehensive plan to protect your well-being during one of the busiest holidays of the year, but also to bring in the New Year safely from a public health and public safety perspective, and home and community safety perspectives as well. We put together a number of precautions in place, and each leader that's gathered here today will speak to the specific plans for which they're responsible. But rest assured, planning for New Year's Eve starts weeks out. We have a comprehensive plan that we all have confidence in, but it really depends upon each of you doing your part as well. In the meantime, I want to especially highlight a few issues, starting first with public health. I don't need to remind any of you that we're still in the throes of this pandemic and are grappling with the spread of the new Omicron variant, which is more transmissible, as we're seeing, than its counterparts. We are still seeing cases rise, meaning that we need to be careful in social gatherings. If you're planning on ringing in the new year with loved ones in an indoor setting, Not only is it vital to be vaccinated and boosted, but also to know your own COVID-19 status. That's why, as Dr. Arwady will explain in more detail shortly, we are recommending to everyone, even those who are vaccinated, to consider getting a COVID-19 test before gathering indoors with a large group, and encouraging anybody who's participating with you to do exactly the same. I know a number of folks have started doing this for weeks, but it's a good practice to get in the habit of doing, particularly around New Year's Eve and New Year's Day festivities. Tests can help protect unvaccinated children, older individuals, those who are immunocompromised, or individuals at risk of severe disease, as well as further prevent the spread of COVID-19 through households and venues across Chicago. Community spread is the biggest challenge that we are facing right now, and we've got tools at our disposal to make sure that we can address that, starting with getting yourself vaccinated. Speaking of venues, I also want to remind folks that the mask mandate for Chicago remains in effect, meaning that a mask is required at all public indoor settings across the city, no exceptions. Many venues will also require proof of vaccinations or a negative COVID test for entry. And as we all now know, starting Monday, January 3rd, any individual aged 5 or older in the city of Chicago will be required to show proof of full vaccination to dine indoors, visit gyms, or enjoy entertainment venues where food and drinks are served. We are thankful to the establishments that have chosen to implement this vaccination requirement ahead of schedule, and many have. So please, folks, if you haven't already, make that appointment to get vaccinated or help one of your unvaccinated loved ones make theirs. That's the best New Year's resolution that you can do and embrace. So go get your booster shot and get a COVID-19 test before you participate in any indoor festivities. Second, we are working to prevent general disturbances and violent crime always, every day, 24/7. And with regard to New Year's Eve, the Chicago Police Department and partners across the city are prepared for large crowds throughout the evening of Friday, December 31st, New Year's Eve, and well into the weekend. And Superintendent Brown will speak to those issues and those plans momentarily. Many people will be out and about downtown, including children. And we want our children to be able to enjoy the richness and greatness of the city. And they are, of course, welcome anywhere. But they should be accompanied by an adult and supervised. And if they're coming on their own, it is vitally important that they must be respectful to others. We have community norms, and we expect those to be upheld, particularly with our young people. Regardless, parents or guardians, make sure that you know where your kids are on New Year's Eve and New Year's Day. Of course, that should be a thing, but it's worth lifting up. No child should be unsupervised or their whereabouts unknown when it comes to New Year's Eve or New Year's Day. And do not simply drop them off downtown and hope for the best. That is simply not responsible. And I say this as a parent. We all have a responsibility as parents or guardians or somebody who is a caretaker for a young person to be responsible for the children that are trusted in our care. And a word to our young people and older adults. And I will say the same thing that I say to my child. It's okay to have fun, but there are always limits, particularly when you're out in public. You must be respectful of others. That means their people, their person, but also their property. And simply put, if you're going to come downtown, you've got to do so with the right spirit, to have fun, but not to cause mischief or worse, commit crimes. And as my mother would tell me, if you go out in public and you act a fool, there's going to be accountability. So have fun. Enjoy yourselves, be careful, but be respectful of the rights of others, including their person and their property. And as I've said previously, many people will be out and about this weekend, making our mission to protect public safety all the more important and pertinent. We want people to enjoy the holiday without having to worry about whether or not they are going to be in harm's way. That's why we're not going to hesitate to take any action necessary against someone who crosses the line and commits a crime that endangers public safety. And as Director Guidice mentioned, we must be safe and vigilant, especially in crowds like the ones that will likely form around the Riverwalk during the fireworks show. So please, if you see something, don't hesitate to say something. And report any suspicious activity to 911. There will be also plenty of police downtown, so if you need to, go to a police officer and let them know that you're seeing something right then and right there, and they will take action. Finally, when it comes to home and community safety, we plan on doing everything that we can to keep people safe under their own roof. But again, that depends upon you. As many of you know, we've had some horrible fires lately. So first, Deputy Fire Commissioner Meyer Sheridan will talk about general safety in our homes and what you can do to make sure your home is protected, not only over this weekend, but throughout the course of the winter. So we're calling on everyone to limit large household gatherings and do not ring in the new year by firing off a firearm. Let me say that again. Don't ring in the new year by firing off a firearm. Bullets go up, but they also come down. And every single year, when someone makes that tragic, stupid mistake, injuries happen. So please, folks, there's lots of ways that you can celebrate safety, but firing off a firearm at midnight shouldn't be one of them. As we go into 2022, COVID is reminding us again that we have to think not only about ourselves, but our entire community and city. After all, what each of us does contributes to the overall protection and safety of everyone in every community. I know this year has been very difficult, and truthfully, the last 2 years have been extraordinarily difficult. People are fatigued, people are frustrated, people are angry. But now is the time for us to take stock, to refresh ourselves and renew and move forward into the next year with a new commitment to do our part to make sure that we protect ourselves, we protect our families, we protect our community. Be smart about public safety, but also be smart about public health. That's the way that we can start to put the pandemic behind us. Let's keep doing the right thing by protecting ourselves and others so that we may all safely ring in the new year. And with that, I'll invite Superintendent Brown to come to the podium.
Thank you, Mayor, and good morning. And thank you to Richard Guidice for hosting us here at OMC. I'm glad to be standing here beside many of our city and public safety partners to discuss our plans for this upcoming weekend. It's no secret that this holiday is a busy, busy time for the Chicago Police Department. But as many toast the new year with family and friends, the men and women of the Chicago Police Department will be working to keep everyone safe. I want to first thank all of the police officers for the Chicago Police Department for their dedication, and to include our civilian members, for their dedication to keeping everyone safe. We've extended our officers' hours, we've canceled days off in order to maintain a visible presence and have the capacity to deal with multiple challenges in our neighborhoods, in our entertainment venues, and in our retail corridors. While we encourage everyone to have fun, as the mayor has mentioned, and to celebrate, if there is any criminal activity, we will take the appropriate action. Constitutionally, legally, respectfully, but we will take the appropriate action. Safety, public safety, is our top priority, and criminal conduct will not be tolerated. Let me say that one more time. Public safety is our priority, but criminal conduct will not be tolerated. We want to deter any trouble before it happens. Additionally, residents can expect to see an increased CPD presence in our public transit system as well. We will have officers in and around CTA stations and help every rider get to and from their destination as safely as possible. I want to remind everyone watching that as neighbors, we owe it to one another to make sure we are doing everything we can to celebrate safely and responsibly. With that said, I am now speaking directly to the parents of young children. I'm a parent of a 15-year-old. Please, please make sure you know where your children are and where they're headed this holiday. Do not drop them off unsupervised anywhere in our city. I want to be clear, if they or anyone of any age are found engaging in criminal conduct, they will be arrested. Repeat that one more time. If your children, if your young people, or any age are found to be engaged in criminal conduct, they will be arrested. My daughter asked me repeatedly, she's 15-year-old, can I just go hang out with my friends? And it is a constant refrain for teenagers, I'm sure, across the city. But it is not responsible to send your kids out to hang out with their friends without adult supervision. Let me share my response. Okay, where are we going? Where are we going? Because I'm going to, or my wife is going to, with your friends to go hang out. And I hope that each of the parents listening can share that same refrain. You want to go hang out with your friends? We're going to hang out with your friends as well, the parents. Lastly, do not shoot guns off into the air to bring in a new year. What goes up, the law of gravity tells us, must come down. In many instances, people are not even aiming in the air, they're aiming at an angle that the trajectory will strike someone across the city. So do not shoot guns off in celebration of New Year's. A safe and happy New Year's Eve for everyone is our shared goal. So we're reminding everyone to think and act responsibly. We all want to be safe this weekend, and we share that aspiration for every Chicagoan. And there's no reason it can't be if we all of us, not just law enforcement, all of us do our part. With that, I'm going to turn it over to Chief of Patrol Brian McDermott to share further details into our weekend planning. Thank you. Brian?
Thank you, Superintendent. As New Year's Eve and New Year's Day approach, the department will continue to coordinate all of its resources to ensure a safe holiday season, not only in the downtown area, but in every neighborhood across the city. The entire department will have days off canceled starting Friday morning, December 31st, with a return to normal operations on Sunday morning, January 2nd. We will have additional personnel strategically deployed across the city in our violence zones, on out platforms, at our retail corridors, and in the central business district on North Michigan Avenue and in and around the Millennium Park area. The Emergency Operations Center, or EOC, is up and running. CPD command staff members will work side by side our partners at the Office of Emergency Management and Communications to monitor all major incidents across the city. There are multiple fireworks displays at Navy Pier, at the Riverwalk, and on 5 bridges at Franklin Street, LaSalle, Dearborn, Clark, and State Street. RDO personnel from the 1st and the 18th districts, from the Bureau of Detectives, from the Critical Incident Response Team, from Training and Support Group, and Public Safety Headquarters will be assigned to assist with traffic control and any potential large crowds. The department has a comprehensive plan in place to deal with any large gathering, whether it occurs in a neighborhood or in a central business district. The plan includes coordination with multiple city agencies, including BACP, the Building Department, and the Chicago Fire Department. We have communicated and coordinated with chambers of commerce and hotel associations. We have coordinated with streets and sanitation to ticket and tow any illegally parked cars. And we have roving teams available both in the central business district and the neighborhoods to respond to any large crowds. The department is also prepared to deal with any large gathering at Millennium Park. We will protect the First Amendment rights and provide for the safety of everybody. But as the superintendent said, anyone coming down to the central business district or anywhere else in the city to engage in acts of disorder or criminal activity will be arrested. We strongly encourage all youths coming down to the downtown area to be supervised by a responsible adult. The department continues to monitor all citywide smash and grab incidents and remains ready to implement its asset and infrastructure protection plan or our retail corridor protection plan at any time. Finally, the department continues to test our emergency response plans in coordination with OEMC by conducting regular emergency mobilization drills, the latest of which were conducted yesterday afternoon and late last night. Lastly, I would like to thank every member of this department who continues to place their lives on the line every day to protect the citizens of the city. Happy holidays.
Ken Meyer's coming up, right? Mary Sheridan? First.
Hi, I'm Mary Sheridan, First Deputy of the Fire Department, representing Commissioner Nance Holt. She was unable to come today. I want to speak a few things about winter safety, and then I just want to echo everyone else's message about safely celebrating the holidays. Space heaters are a problem. Please don't leave space heaters unattended, and please do not plug space heaters into extension cords. Please do not use grills, the stove, or gas heaters to heat your homes because they produce carbon monoxide. Please check the batteries in your smoke detectors, your carbon monoxide detectors. If you need smoke detectors or carbon monoxide detectors, please reach out to community agencies for assistance. Please, we've just had our first measurable snowfall. Please keep your sidewalks, the fire hydrants, and your steps clear in case you need to call 911 for assistance. Please look out for your elderly neighbors. If they're unable to clear their walks, please assist them with shoveling their walks, clearing their steps and porch, so should they need 911, we can come in and assist them. Lastly, I want to echo everyone else's message about celebrating safely. Please leave the fireworks to the professionals. Either come downtown to enjoy the fireworks or please watch them on television. They're spectacular. Please celebrate responsibly. Do not drink and drive. Please utilize public transportation, taxis, or ride share to travel to and from your holiday celebrations. On a personal note, my children survived their teenage years. So there's hope for all you parents. The fire department wants everyone to celebrate responsibly, have a great new year, and let's all pray that by following guidelines, we'll have a much healthier 2022. Thank you. And Mr. Ken Meyer from BACP is going to speak.
Thank you, First Deputy Sheridan. Thank you, Mayor. Good morning. My name is Ken Meyer, and I'm the Commissioner for the Department of Business Affairs and Consumer Protection. As we've seen over the course of this holiday season, COVID-19 cases continue to rise. So in response, on Monday, January 3rd, the Chicago vaccine requirement will go into effect to slow the spread of COVID-19 and to help us continue our path to recovery. The requirement means any individuals 5 years of age or older will be required to show proof that they are fully vaccinated against COVID-19 to dine indoors, visit gyms, or enjoy entertainment venues where food or drinks are being served. Also, anyone over the age of 16 will need to show identification to compare with their vaccination card. The decision to show proof of vaccination was made after meeting with and listening to our partners on how to best structure this policy. The vaccine requirement is a collaborative effort that prioritizes the health of Chicagoans. This is necessary and intentional policy, which in fact has already been in place voluntarily by many establishments in the hospitality and performing arts industry thus far. The new order will standardize health protocols across businesses and industries. Patrons will know that they must show proof of vaccination, while businesses will have a consistent vaccine requirement. As part of the vaccine requirement, establishments will be required to, 1, post signage at each publicly accessible entrance, and at least one location informing patrons of the vaccination requirement. And 2, businesses also must keep a written record describing the protocol for implementing the vaccine requirement that they must make available to city officials upon request. The signage and guidance for the written record are available by visiting chicago.gov/COVID. Again, chicago.gov/COVID. This order covers a variety of business types and industries, and we are therefore providing guidance to consider when creating the written record to comply with the order. The guidance provides tips for establishments and a sample that can be used. The enforcement of the vaccine requirement is no different than the mask mandates, previous public health orders, or general guidelines. To provide an overview of the Chicago vaccine requirement, we have hosted one webinar last Wednesday with over 300 attendees, one this morning, and we are hosting another webinar on Tuesday, January 4th at 2 p.m. In case you've missed a webinar, you can find the full recording at our YouTube channel, which is youtube.com/ChicagoBACP. To register for the webinar, please visit chicago.gov/businesseducation. Businesses seeking more information guidance should visit chicago.gov/COVID. As a reminder, the Chicago mask mandate does remain in effect for public indoor settings. We encourage citizens to call 311 to report violations. All are parts of a comprehensive effort to ensure compliance and to hold businesses accountable to these safety regulations designed to keep all Chicagoans safe. Please keep this in mind for New Year's Eve and weekend celebrations occurring in indoor public settings. Lastly, I know Chicago businesses have stepped up repeatedly over the last 20 months to keep their customers and employees safe, and we must again do what is necessary to protect Chicago and save lives. Thank you, and now I'm going to pass the podium over to Dr. Arwady of the Chicago Department of Public Health.
Thank you. So as we head into our second New Year's celebration in the time of COVID, we've been getting a lot of questions about how to keep yourself safe in multiple ways, including your health during New Year's celebrations. I want to start by reviewing the shortened isolation guidance for the general population. You may have seen the CDC news on this, and yes, here in Chicago, for the general population, we are following this guidance. Regardless of your vaccination status, if you test positive for COVID-19, you must isolate. There is no need to repeat a positive at-home test in a medical setting. We don't want people going into the emergency department just to get tested. Treat a positive as a positive, stay home and isolate for 5 days. After 5 days, if your symptoms have resolved, you can leave your house, but you must continue to wear a mask around others for an additional 5 days, and you should avoid contact with high-risk people. If you're still feeling sick, if you still have a fever after 5 days, you must continue to isolate at home until you feel fine. This is being done in part because with the new Omicron variant, we are seeing everything speed up. We are seeing people get infected more quickly, spread earlier in infection, but then in the great majority of cases, no longer be infectious later in the time period, like we saw at the beginning. I have bad news when we look at our COVID case rates in Chicago. Our case rates are rising sharply, just like nationally, just like across the state of Illinois. Here in Chicago, our COVID cases right now are higher than they have ever been. Our current average case rate is 3,825 per day, and we've had a daily total a few days before Christmas with 5,338 cases. You can see this shows the number of positive cases throughout the pandemic, and we are significantly higher than we've ever been. There are parts of the country doing much worse, but don't kid yourself that things are in good control from a COVID perspective. Similarly, our test positivity here in Chicago is the highest it has been since the first wave of the pandemic. Our current positivity is 16.2%, up from 8% a week ago, 4% a week before that. We've been seeing that double. That is the Omicron variant. But different from last year, when we were also in a surge, is that we have good news still about the vaccine. Right now, we're worried about hospital beds. Our non-ICU hospital beds occupied by COVID-19 patients are at the highest census they've been since December 2020. And ICU beds are also at the highest census. Although you see, compared to where the peak has been, we still have some capacity, and we're monitoring this very closely. I want to thank all the healthcare workers taking care of a lot of sick people in the hospital right now. The good news is that the vaccine is still highly protective against infection, although yes, we are seeing more breakthroughs with the Omicron variant. This data on this slide here is just Chicago residents, and if you look since Thanksgiving, where that black line is, you see that big increase in the red. Those are cases in unvaccinated Chicagoans. Yes, in the light blue, we have also seen cases increase in vaccinated Chicagoans, and in the dark blue, we have seen some cases in boosted Chicagoans as well. But by far, the biggest risk for infection remains among people who are unvaccinated. And I hope a chart like this helps encourage you to get the vaccine or the booster if you haven't. More importantly, the other piece of good news, and this is what is driving in a lot of ways our decision to require vaccination in many indoor settings, is that vaccines continue to protect beautifully against COVID hospitalization, and boosters add to that protection. This is that same graph. You see that dark line for Thanksgiving. Unvaccinated Chicagoans are who are largely in the hospital right now with COVID. You can see that throughout that big surge, in the light blue are our vaccinated Chicagoans, and down at the bottom, in the darkest blue, boosted Chicagoans. Almost nobody is in the hospital with COVID right now in Chicago who is vaccinated and boosted. In the few examples where we see this, it tends to be people who are older or with severe immunocompromise. But our hospital surge, make no doubt about it, is being driven by unvaccinated Chicagoans. We need to do everything we can to protect our hospital capacity, but I am very reassured, as I hope you are, that this safe, effective, and widely available vaccine continues to perform as well as it is. So what do we do New Year's Eve to protect ourselves and our community from COVID and its variants? The news is not different. First, we vax up and boost up. Second, we mask up. We've gotten some questions about masking, and certainly I encourage you, it's a requirement, of course, to wear a mask within public indoor settings in Chicago. The most important thing is that everybody is masking. But if you want to add to your protection, you can do something as basic as putting one of these surgical masks, widely available, and put a cloth mask right over top of it. That adds to your protection at a time when COVID is surging. You're also welcome to wear KN95s, KN94s, other masks that have additional levels of protection, but the most important thing is that you're wearing a mask. You should back up where you can. I'm really pleased that the fireworks celebrations this year, not only are they, of course, out of doors, but there's been a lot of work to spread them out along the river, along the lake, giving the opportunity for people to celebrate in as safe a way as they can, out of doors and more space than we've been able to have previously. Obviously, hand washing, the basics remain important, and then testing. So guidance for gathering in Chicago, always first and foremost, the most important thing, get vaccinated and boosted. I am not gathering right now indoors with anybody who is not vaccinated and boosted, as much as they can be, of course, for age. I encourage you, of course, to wear a well-fitting mask. The fact that your mask fits well is more important than the little details of what kind it is, but put it on, get a good seal. Avoid gatherings and travel if you are not fully vaccinated. Full stop. 49 states are on the travel advisory this week. The entire country is surging. You are putting yourself and everybody at risk if you're gathering or traveling and you're not vaccinated. And if at all possible, do get tested before gathering, and that's regardless of a vaccination status. I know that it is harder to find a test right now in Chicago because we are in this surge. That is true around the country. The health department has been distributing tests in a lot of our highest need neighborhoods. We've been working to build additional capacity. But if you've got at-home tests, take one on the day that you're gathering and go ahead and order some so you have them available for the future. And finally, if you are sick, stay home. There is a good chance right now with those numbers like they look. If you think it's a cold, you think it's the flu, it's probably COVID. We need you to stay home if you are not feeling well. I don't want you feeling like, maybe I have a cold, I'm gonna go get a test, the test is taking a while to come back, so I'm gonna go out and celebrate. No, this is the New Year's. If you are not well, to stay home. Finally, visit chicago.gov/COVID for more information. With the new requirement going into place on Monday, I'll remind you, you can carry your vaccination card, but you can also just keep a copy on your phone. It's as simple as taking a picture of your card, adding the photo to your favorites, so you can access it quickly. I encourage you to do this because we're all gonna be showing our cards a little bit more over the days to come. And finally, if you need a vaccine or a booster or you have any questions, you can always call 312-746-4835. We are still signing people up for at-home vaccinations and helping you with whatever your needs are. I wish you a happy and safe New Year's. Thank
you. Before I take questions, let me also just recognize and thank Navy Pier CEO Marilyn Gardner, who's with us today. She and her team have weathered a lot of storms, and I think are going to put on a tremendous New Year's Eve celebration. So thank you, Marilyn. I also want to thank the men and women who are here of the Chicago Police Department. These are the senior leadership of the department who are on the front lines every single day, making sure that our residents are safe. I want to publicly thank them for all the sacrifices that they have made over the course of this year, what they're going to make in the future. I also want to say thank you to the families of the men and women of the Chicago Police Department who also bear a burden and responsibility because their loved one has chosen to serve the city as a Chicago police officer. So thank you to them as well. Happy to take your questions at this point.
2 questions, and we'll start with Tamar.
Hi, Mayor.
Hey, how are you?
Doing great. So it sounds like the show is going to go on.
Yep.
And despite you encouraging people to just watch the fireworks at WGN, which makes us really happy, no doubt many people are going to still choose to go out. How worried are you that we're just going to have a bunch of super spreaders this weekend? And also, can you share with us your New Year's Eve plans?
Well, look, I think that people are going to go out, recognizing that. That's why we're having this press conference. That's where we're going to continue messaging all the way through New Year's Eve and New Year's Day for people to be smart. But what I also know and what I'm hearing from my friends and other people in my network is that they're concerned about the surge that we're experiencing, and they're going to take specific precautions like not going out, like limiting, if they are going to have a gathering, limiting it specifically. And I think that that's very smart and wise, and we're going to keep messaging to people. This virus, this variant of Omicron is significant. If you saw the slide that showed the huge spike in cases, you know, we're at, 3,700 on average a day? Not that long ago, we were at 300 something a day and on the downward slide. And this is just doubling and doubling and doubling week after week. So people have to be smart, recognize that the pandemic is still with us, that the Omicron variant is real, and that they ought to do everything that they can to make sure that they protect herself. And as for my plans, well, my wife is celebrating her birthday on New Year's Day, so on New Year's Eve, so we'll be spending time together. And of course, I've got to watch Michigan in the playoffs.
Are you saying, Mayor, then that I have a right to go out, but I probably shouldn't this week?
But what I'm saying is you got to be smart. And I'm not going to be the mom and tell people what they should and shouldn't do, but I know what I'm going to do, which is to be close, make sure that if I gather, then I'm only gathering with people that I know are vaccinated, particularly boosted. And in gatherings that I've been in social settings, we are having people take a test to make sure that they're not positive. We've seen a number of breakthroughs. It's still relatively small, but you know, I don't think you can do enough to be cautious in this environment. What we're seeing, and I don't want to play epidemiologist here, so I'll invite Allison to come back up or give me the look if I'm straying too far. It looks like from what we're seeing in South Africa, there's a huge surge in these cases, and then they start to come back down. We're still very much in the upward trajectory of the cases and surging. Certainly our hope is that we will follow the same pattern, which the surge will end and we'll be on the backside of it. But we don't know if that's happening or and if it's going to happen, when it's going to happen. Right now, we're in the upward trajectory. I still am nervous about the fact that we see such a huge spike in cases, hospitalizations, and deaths. We've got to pay attention to those metrics, and that says to me, you got to be careful. All the things that we know that have worked and served us well, we've got to do those things and multiply it. I said a week ago, we got to put the armor back on. Masking, vaccinations, social distancing, washing your hands, being careful about who you're associating with and how long, all those things matter in this time. And go blue.
Hi, good morning. Stephen here with CBS Chicago. Just with other cities like New York scaling back their fireworks, and San Francisco, for example, they're canceling this altogether. What do you say to first responders and hospital workers here in Chicago about the reasoning behind not just canceling or dramatically scaling back? We look at people we know they usually gather closely, even if they have space. So can you talk about that?
Yeah, I'll start and then I'll turn it over to Allison. Number one, let's keep in mind it's outdoors. And there was a conscious decision made, not only obviously that it's outdoors, but to spread it out so we don't have massive crowds gathering in one place. But clearly, if people are going to choose to go downtown and watch the fireworks, they should follow the admonitions that we've been giving all along, which is social distance, wear a mask, make sure that you're taking other precautions. But I'm going to be home watching the fireworks on my television set, and I encourage other people to take advantage of that. And frankly, you're going to have a better viewpoint unless you're, got a hotel room and a high-rise or what have you. But look, we have to manage through this surge. And the best things that we can do is get vaccinated, get boosted, wear a mask, and make sure that we're social distancing. And that's exactly why we're standing here today, why we're going to keep talking about the precautions that we should take. If this was indoors, it'd be a no-brainer. It would have been canceled. But since it's outdoors and we're spacing people out, we have some confidence that we're going to minimize and mitigate. But the reality is if people don't take the COVID virus seriously and this Omicron variant seriously, we are going to see circumstances where they're spread. That's why people have to make the decision that's in their best interest, in their family's best interest, and in their long-term health best interest. And in many instances, that's going to be, you know what, I'm good, I'm going to stay home, I'm going to watch it all from my TV, or I'm going to do something entirely different. But if you are coming downtown, be smart, be safe, follow the public health guidance.
I would just echo that we historically see people gather around holidays at some level, regardless of the guidance that is given. I would much rather have people outside than inside if they are going to be gathering. And the idea of having done what we've been able to do to space some of that out, I think certainly makes sense. I know there's been a lot of public safety considerations around that as well. And I do think actually having something available for people to watch on TV from home actually also gives some incentive there for people who are making the decision, because everybody in Chicago knows somebody with COVID right now, to stay home. So I am in full support of continuing with this because it is outdoors, more spaced out. But if people are going to come down, the masking will help. It'll probably be cold, so people in Chicago tend to keep those masks on more outdoors, but there is not a requirement. The indoors remains by far the highest risk, and we're living with COVID at some level. This is our second New Year's with it, and where people are vaccinated, boosted, tested, masking, we're continuing.
Dr. Arwady, can I follow up on that? Because you said something that piqued my interest about the flu. Because I've heard people say, I have the flu. I've heard people say, I have a cold. And now, what is your medical guidance at this point when it comes to people flu. What are you recommending, and how do you tell the difference? And should you
Not to go to the
be telling the
emergency,
difference,
right.
or should a doctor be doing that?
Yeah, so a couple things. We monitor the flu also at CDPH. We have for years, and you can look on the website if you want to see what those numbers look like. We are seeing more flu than last year, but not a lot compared to what we are seeing with COVID. Chances right now are very good that if you have flu-like symptoms, you have COVID. I do not want people going to the emergency department unless they are in need of emergency medical care. I don't want somebody saying, you know, I'm not feeling that well, but other, you know, I'm not having problems breathing, I'm not having anything major here, but I'm just kind of worried and I want to test because I want to know. We don't want you going to the emergency department for that. We want you staying home, period. And if you're able to get a test, get a test. But like I said, one of the reasons why I encourage people, if you get an at-home test, a common question we get is, I got an at-home test and it was positive. Shouldn't I go out and try to get that confirmed? Right now, no. A positive test is positive, and you need to isolate for at least those 5 days. And you know, chances are quite good if you're vaccinated and boosted, 5 days later, your symptoms will likely be gone. And that's part of why that guidance around isolation has changed. But right now, presume a cold or a flu is COVID unless proven otherwise, and treat it as such. Isolate at home and skip the fun for New Year's.
Let's go back to Steven so we can get a second.
It was about the flu. I was just curious about flu numbers and it possibly merging with COVID hospitalizations. I talked to a hospital director who just mentioned that we're in for a really tough winter after this. So
Yeah. Yeah, absolutely. So flu shots remain widely available. Please go get one of those as well if you have not. Flu every year is our predictable pandemic. In terms of every winter, we see an increase, and we know that it is a time that can make hospitals more full. Our worry, first of all, COVID is not the same as flu in that here in Chicago, it's been about 10 times as likely to put somebody in the hospital. So I sometimes hear people say, this is just flu, why are we worried about it? I wish it were behaving just like flu. Unfortunately, for many people, it's been much more serious. But yeah, we're watching really closely the COVID numbers, the flu numbers, and all the other things that put people in the hospital this time of year. I will say that we have all of the hospitals around Chicago. They are reporting to us every day how many hospital beds they have available, how many ICU beds, et cetera. And not just beds, but how many they can staff, because they are also seeing infections and breakthroughs in their own staff. And so we're watching this very closely, but it certainly, as you saw, my top concern remains that most of the people, almost all of the people being admitted to the hospital right now in Chicago with COVID, with the Omicron variant, are unvaccinated. And that's really what we need to change, first and foremost, to protect the hospitals.
Good morning, Michelle Gallardo with ABC7. I have a question for
Can you just speak up a little bit? I'm sorry.
Yes. Michelle Gallardo with ABC7. I have a question for you, Mayor, and for Superintendent Brown. For people who have decided that they do want to come downtown for what sounds like it's going to be an amazing display, what assurances can we give folks in terms of crowd control, especially when we're dealing with such a large area from east to west, in terms of, is it safe for me to come down with my family to watch the fireworks?
It is safe for you to come downtown. As I said, you know, every year, obviously, we prepare for New Year's Eve festivities and New Year's Day. The planning this year started weeks ago, as it always did, and Chief McDermott of Patrol kind of gave you a top line, but there's very detailed plans and coordination, both in terms of personnel on the ground, various points throughout the downtown area, particularly along the route where the fireworks are going to be, additional resources that are coming downtown, but also out in our neighborhood. So it's a very detailed and comprehensive plan. Obviously, we're not going to share all of it now, but we take safety very seriously in Chicago, particularly around these large events. And Chief McDermott, the first deputy, and the superintendent and others have been hard at work with partners across the city, making sure that we really leave no stone unturned to be prepared. Superintendent?
Yeah, I would just add, you know, we have significant resources dedicated to the weekends to ensure everyone's safety, that it's safe to come downtown, that it's safe in your neighborhood, wherever you live. But I would also add this, you know, police officers can't do it alone. We need everyone involved, when you see something suspicious, please report it right away. How we're going to come out of what we've been experiencing these last 2 years is that more and more people get involved in public safety. And so law enforcement is dedicated, significant resources are dedicated for not only crowd control, but we have a significant aggressive traffic control plan to get people in and out, both ingress, egress on freeways and off ramps, et cetera, as well as our violent zones throughout the city, ensuring that our neighborhoods are safe as well.
Superintendent, may I ask a follow-up with respect to the neighborhoods? With so many officers flooding the downtown area, understandably, can you reassure people in the neighborhoods, especially in districts, for example, like 16, where we know that they've had an issue with COVID outbreaks, and there are a lot of folks out on medical. Can we reassure folks in the neighborhoods that they will have enough resources to deal with whatever comes their way?
Yeah, we've been reassuring people recently, as early as yesterday, about the resources dedicated to our neighborhoods. That's primary goal for us. And downtown is a neighborhood as well, even though we focus and get a lot of news covering what's happening downtown. Downtown is a neighborhood no different than any other neighborhood. So we have adequate resources for downtown, but we also have the same emphasis on resources in all of our neighborhoods across the city. You know, this is every year we add more and more resources to be able to cover all the events over all of our holiday weekends, particularly New Year's Eve, New Year's Day, and the same is true this weekend.
Dr. Arwady, Regina Waldrop from NBC5 News. Can you break down the symptoms we're seeing with the variants of Omicron specifically? We've heard a lot about sore throats, congestion. Is sneezing a symptom? What are hospitals and doctors seeing right now?
So hospitals, for the most part, are seeing people seriously ill with COVID, especially the unvaccinated. The symptoms that we're seeing are not different with Omicron than they were with Delta, than they were with the original. It's just that where we are seeing more what we call breakthrough infections. So the vaccines continue to protect, but not as well against infection, although they continue to protect beautifully against severe illness. So what is different is that somebody, especially if they're fully vaccinated, if they get COVID, as opposed to getting seriously ill and having fevers for days and difficulty breathing, et cetera, they may only experience it as a mild illness. They may only feel like they have a cold. That's good, because they're not getting seriously sick, they're not threatening the healthcare system, but it's certainly of some concern because they do have the potential to transmit to others. And so again, there's no way to know whether somebody has a cold, flu, COVID without a test. But right now in Chicago, chances are very good it's COVID until proven otherwise. And so I want people to consider it COVID. Go ahead and order yourself even if a test, even if it's going to take a few days for it to come, and we can confirm that then. But I would rather people err on the side of assuming right now, with the numbers like they are, regardless of that new symptom, that it is likely to be COVID. But people who are unvaccinated are presenting the same way: fevers, cough, chills, shortness of breath. Yeah.
When it comes to vaccines, is there one that protects you better against the Omicron variant?
Yes. So in the data, what we've seen is that both the Pfizer and Moderna are more protective than the J&J against the Omicron variant. And so the CDC has changed its guidance to recommend, as the first choice, either Pfizer or Moderna. I want to reassure people that the J&J vaccine continues to do a good job of protecting against those severe illness, but we are seeing more breakthroughs. And so it's especially important for people who got the J&J vaccine, if it's been just 2 months, please get a booster and have that booster be either Pfizer or Moderna. If you started with Pfizer or Moderna, your booster can be the same, but for Johnson & Johnson, I would recommend a shift to Pfizer or Moderna for the booster. But the most important thing is to get vaccinated. And all 3 vaccines do remain available because we know that there are people who continue to prefer the J&J vaccine. I'm fine with that, but make sure you get a booster 2 months later.
LBO sometimes.
Yeah, but, for the downtown fireworks show, do people have to wear masks? And also a second question, will the city be doing anything to add additional resources for testing sites throughout the city?
Yeah, so the mask requirement remains in place for any indoor settings in Chicago. We are not mandating masks for outdoor settings. Again, this is based on everything that we know about COVID. That said, I would encourage you to keep your mask in your pocket. If you're in a crowd, you're feeling like it's harder to distance, put the mask on. It'll help keep you warmer anyway. But no, it is not a requirement, and we don't have an intention at this point of requiring masks out of doors. Where we see spread still is indoors. And related to testing resources, so CDPH has already been working to get additional testing resources. There is a supply problem across the whole country. And so as quickly as we are able to get them, those rapid tests and others, we've been using community-based organizations and others to distribute them, have about 150,000 out just over the last couple of weeks here. Obviously, other partners have also distributed testing. But even if you look at distributing, 300,000 plus tests in the last week or two, which is where we are, that's 1 in 10 Chicagoans, and still we are seeing demand for testing be high. That is because our COVID surge is so big, and that is part of why I am encouraging people, if you're not able to get a test or your test is taking a longer time to come back because the whole country is surging, so the lab capacity is also lower, assume your test is positive until it comes back, would be my recommendation if you're taking it. But yes, we do certainly continue to work on growing that and are looking to the federal government for additional resources to support that as well.
I got the stand-up teases and the tags all written. Yep. I know, me too. Get it all written. I'll shoot it in here.